Hi there. I was just about to read this story. Feel free to get comfortable and listen along. Once upon a time, there was a mighty ship caught in a storm at sea. As the waves tossed the ship about, the captain tried to manage the situation by himself. He was the captain, after all. He even had the fancy hat to prove it. As the waves crashed angrily over the sides of the ship, the first mate approached the captain to tell him he had seen some dangerous jagged rocks just ahead. But the captain said he had it under control. Then another crew member, who had just watched his shipmate get dismissed, told the captain that the gunpowder in the ship's hold had spilled everywhere. The captain said not to worry about it, that he was in charge. He reminded them that, after all, he had the fancy hat. Suddenly, a third crewmate noticed that a group of unpleasant-looking pirates was approaching from the starboard side, but since the captain hadn't listened to anyone else, he decided to just not bother saying anything. This story goes on for a while. Oh, that's not good. Let's just skip to the end, shall we? Yikes. This story does not have a happy ending. But it could have if the captain had just been willing to listen to and respect his crew. Historically in healthcare, we've had this problem too. In many cases, physicians were supposed to have all the answers, and it wasn't encouraged to question them, voice concerns, or offer up alternative ideas, even when doing so would protect a patient from harm. And, like the dynamics from the story, this model of healthcare is outdated and doesn't support our values of don't harm me, help me, be nice to me. At RWJBarnabas Health, a foundational element to our high reliability culture and goal of reaching zero harm is mutual respect. If we have mutual respect across all professions and roles, we will all feel safer to speak up. We can actively work on fostering a culture of mutual respect by reducing power distance. What's power distance? Glad you asked. Power distance is defined as the extent to which the less powerful believe and accept that power is distributed unequally. It is a measure of the difference in the power of influence between two people, as perceived by the subordinate, where one person feels the other person's input is more important because they have more education, more power, more tenure, more privilege, more rights, or more intelligence. This explains why, in the case of physicians in healthcare, historically there was a lot of power distance. An important thing to note is that it is the perceived power distance, not necessarily the real difference, or not necessarily intentional on the part of the person in the position of power. It is the distance as seen by the individual affected. In other words, person A may not actually have, or even think they have, more power than person B. But if it feels like they do, and the culture around them affirms rather than rejects that feeling, it's going to affect how safe person B feels to voice concerns and offer ideas. Our culture and how we interact with one another is the strongest contributing factor to power distance. Imagine a physician, we'll call him Dr. X, has had a bad night after being woken up numerous times by a nurse who doesn't have all the information he requests due to an urgent situation with a patient. Tired and frustrated, Dr. X lashes out at one of the nurses in an aggressive manner. His outburst contributes to the power distance that then becomes very difficult to overcome. And unfortunately, there's a ripple effect. His words and actions may affect a different physician years down the road because that same nurse, remembering the bad experience of calling a physician in the middle of the night, is now afraid to make the call when a patient needs it most. In healthcare, the interpersonal relationship between nurses and physicians isn't the only example of navigating power distance. People throughout our organization who work in administration, food service, patient transport, radiology, and other areas are also constantly navigating the power distance they feel between themselves and others when deciding when or if they should speak up about an issue. At RWJBarnabas Health, by working to reduce the power distance between team members, we are actively increasing psychological safety. Psychological safety is the feeling that everyone's ideas, concerns, and observations are not only valid, but valued. When psychological safety isn't a priority, people can feel hesitant or fearful to speak up, which translates directly to an increase in harm events for our patients and each other. Our goal at RWJBH is to constantly be working to reduce power distance and create psychological safety for all, so that we have barrier-free communication and teamwork. The fear of speaking up is greater for some people more than others, depending on their lived experiences and diverse identities. Power distance and the resulting lack of psychological safety is intensified for individuals who have been underrepresented and those with historically undervalued perspectives. For instance, team members who are Black, Indigenous, people of color, LGBTQ+, or team members with disabilities. But when we acknowledge that those differently lived experiences and unique identities can provide an insight that wasn't previously available, we can then be intentional in soliciting those viewpoints to the ultimate benefit of our patients. There is one thing we should know, though. Understanding the need to lessen power distance doesn't diminish the need for strong leadership. We will continue to have leaders and hierarchy, but we know when it comes to speaking up and sharing ideas, thoughts, and concerns we are all on the same level, and everyone should feel respected and heard. This barrier-less or barrier-free communication builds trust, so that when decisions ultimately need to be made, a leader can take charge with the rest of the team's support and confidence that he or she is making well-informed, goal-aligned decisions. For instance, when we have a code blue or other emergency and someone must take lead. Recognizing the reality of human teams means realizing we don't always get this right, but that we can always be striving for better. Reinforcing that everyone is human and makes mistakes, even healthcare leaders, allows for the vulnerability and reflection needed to make adjustments and ultimately reach our goals. So, now that we know what power distance is and how it impacts psychological safety and why that matters for both our healthcare team and our patients, what can we do about decreasing it? In situations where you might feel hesitant to voice a concern because it seems safer to stay in your lane, remembering that sharing your input or unique observation might help prevent harm to a patient should encourage you to speak up confidently. When applicable, use the phrase, "I have a safety concern," to shine a spotlight on your intentions. We will also learn tools to use in these situations called ART, Stop the Line, and Asking Clarifying Questions. Remember, you may be the only person who has noticed a particular problem, and therefore the only person who can prevent it from getting out of control. We will have your back when you speak up about a safety or reliability concern. In situations where you recognize that you are the one with the perceived power, inviting feedback and encouraging others to participate in the conversation sets a tone of transparency among the entire team. Phrases like, "I value your feedback," "I need your help," "What do you think?" or "What questions do you have?" let people know it's safe to speak up. When people do speak up, validating those thoughts and concerns is a major part in making open communication a part of our culture. And it can usually be done with a simple thank you. Making it a point to thank people for their input makes them more likely to contribute ideas again in the future. And each time someone feels empowered to speak up is an opportunity to stop a harm event before it happens. At RWJBarnabas Health, we're a team working together for the common goal of excellent patient care with zero harm. And we need everyone's voices and perspectives to make that happen. We will continue to reduce power distance and increase psychological safety at all levels for all leaders, medical staff, and team members. We're ready to listen.